Hi. Just wanted to give you a little update. This is March 23rd. We're up to 471 total deaths in the United States. What have we learned? Well, one, we didn't get to shelter in place fast enough, and still the government has not put out a countrywide mandate, nor has every governor. So, unfortunately, we are not slowing this enough. The rate of deaths will continue to double every 2 to 5 days. Currently, we're at a 2-day doubling rate. Hopefully, we can slow that down, but as you saw, these curves are alarming. It is estimated that 40 to 80% of us are going to have to go through this. And it's probably going to be like a flu, bad flu, possibly, for many of us. Many of us, it's going to be okay. Clearly, some people have gone through this without even really knowing it. But plenty of people of all ages get really sick. So the key is, one, now, we do not want to get those people sick who have a problem already, because that can throw you over the top and land you in the ICU or worse. So we really want to avoid, and we really want to encourage those people we care about who are older or have other issues, medical issues, to isolate themselves and not let people around. This is a weird time, but it means not hugging grandkids and not, connecting in that way. We can connect other ways, call, let's talk, video, but let's just isolate now while it calms down. This will end, no matter what, as enough people catch it, get through it, or we develop a vaccine, or we develop enough medicines to suppress the virus so it can't be transmitted like this. It will end, one way or another. Once 80% of us get it, good. It's done. It's like most other infections that we either have to get as kids, like chickenpox, like we used to, or we can immunize against, like chickenpox now. Now we can't do that with this one. We got to wait till everyone gets it. And and if we all get it at the same time, there's nowhere near enough health care to take care of us all. So the point now is, let's slow down the rate at which we get it. Don't be selfish and get it now. We may, and the other good news is the longer we wait before we get it, the more potential science has been done to show what works and what doesn't. Over the last week, I'll give you an update on some of that. It turns out that the HIV drugs that looked promising a week ago didn't pan out. They don't work better than placebo. Some countries, China and some other places, still recommend using them, but what I can see, the science says they're not working. Chloroquine and azithromycin have some interesting data that the president was very excited about, but again, we don't know. That's being used right now in patients who are facing this, and we will know much more in short order about what works. Does that make you better? Because, geez, if we have medicines for this, so we know it's not going to be that bad, okay, then we can also wait our turn to get infected, or even better yet, maybe we come up with an immunization. Now that likely is a year away, if then, but given the nature of what's going on, this entire pandemic, this is a world-changing event, and because of that, everyone is focused on this. And they're not negotiating salaries and this and that. Everyone gets it. It's time to stand up, do what you can, help, work on it if you can. As a scientist, as a manufacturer, personally, I think we need to have the government demand that certain manufacturers quickly make all the healthcare equipment we need, protective masks, ventilators, so that we can control and manage patients as they get this virus. So that's what's going on this week, and I'll check back next week if I'm able and willing. All right, bye.